My name is Anita Bošnjak. Thank you for the opportunity to present the Croatian experience on how to implement the Neo-BFHI program on the national level. When we talk about the translation of the evidence into policy initiatives, I am going to present how 3 guiding principles, 10 steps, and the code of the Baby-Friendly Hospital Initiative for Neonatal Wards, or the Neo-BFHI program, were implemented in all 13 NICUs in Croatia after education of the staff in all NICUs. Here, the evidence is that education of the staff increased the compliance with implementation of basic principles of the Neo-BFHI policy. What do we already know about this subject? According to the evidence, the implementation of the Neo-BFHI can result in better neonatal care and improve breastfeeding rates in NICUs. We also know that education of staff can result in a better quality of care and more satisfaction and involvement of parents. And finally, structured approach to delivery of care is easier for staff to adopt. What policies were the most challenging to implement? One of them was Guiding Principle 2, which states that the facility must provide family-centered care. Another was Step 4, encourage early, continuous, and prolonged kangaroo mother care. The third one was Step 7, enable mothers and infants to remain together 24 hours a day. In addition, it was challenging to achieve fully compliance with the International Code of Marketing of Breast Milk Substitutes and relevant World Health Assembly resolutions. What were the results of our activities? In 2017, an international study called Measuring Compliance with the Neo-BFHI was carried out, aiming to measure policy and practice of breastfeeding support in neonatal wards. 36 countries all over the world were included, and Croatia was among them. And our results were as follows. The lowest scores in Croatia were obtained for Guiding Principle 2, about family-centered care. As you can see, we achieved score 67 versus 82. Here, 67 and 82 means median score achieved on particular indicator. The lowest scores in Croatia were also obtained for Step 4, about kangaroo care, and Step 7, about rooming in. In addition, Level 3 NICUs achieved less favorable scores on those 3 components compared to Level 2 NICUs. Next, in the majority of Croatian NICUs, the estimated daily duration of kangaroo care was less than 4 hours, which is something we are not happy with. And finally, 69% of our NICUs reported a free 24/7 maternal visiting policy, while unfortunately 85% were restrictive regarding paternal visiting. Despite those issues, the country scores on GP1 and Step 1, 2, 5, 6, 8, and 10 were above the international scores, and compliance with the code was high. How was the evidence translated into policies? The staff of Croatian NICUs were educated to implement guiding principles, all 10 steps of the program, and compliance with the code. And it should be emphasized that all NICUs in Croatia have been exposed to the same well-structured course at the same time. The involved stakeholders of this process were Ministry of Health of the Republic of Croatia, UNICEF office in Croatia, and Society of Perinatal Medicine of the Croatian Medical Association. What were the key activities? Translation of the materials needed to implement the Neo-BFHI program, training of trainers in our NICUs, education of all NICU staff, implementation of the Neo-BFH program in all NICUs, evaluation of NICUs within the international project and extrapolation of national data and comparison of the data with general obtained results, discussion of the results with the staff in NICUs and also directors of the NICUs, and taking steps to improve results which have been worse compared to overall results. Why was the initiative successful? The staff in Croatian NICUs were very interested in the implementation of the Neo-BFHI. We made our original documents for the staff education produced in Croatian language, considering local circumstances. And finally, 11 out of 13 hospitals in which the Neo-BFHI was implemented were designated as baby-friendly hospitals, which made the process of Neo-BFHI program implementation easier. However, there were some obstacles. For example, although education was both theoretical and practical, not all staff members fully adopted the policies of Neo-BFHI. In addition, monitoring or assessment of the implementation of the Neo-BFHI at the beginning should be more frequent to overcome difficulties or challenges. And finally, as I said earlier, 2 NICUs in non-delivery hospitals were not part of accredited BFHI institutions, which made the process of the Neo-BFHI program implementation slightly more difficult for them. Thank you for your attention.